Hello everyone, welcome to sqadia.com. I am Hina Khan and today the topic of our lecture is intracranial injuries. Now, any sort of injury to the brain, to the scalp and the skull relates to these intracranial injuries, and this can range from the milder bruises to the more jagged lacerations. Now, in this lecture, basically, we'll be dealing in the first section the forensic anatomy regarding the cranial structures, and the extradural hemorrhage and heat hematomas are discussed in the first section. Moving over, we'll be discussing the subdural hemorrhage and the hematomas and the consequences that we're going to face in these complications, and how are we going to deal with them, and how are we going to basically forensically relate to them. Now, the second section basically deals with the subarachnoid haemorrhage. Now, the arachnoid space is very prone to these sort of hemorrhages in cases of trauma, and the appearances and the mechanism of formation is discussed in this second section. Secondly, we'll be discussing the forensic implications to these subarachnoid hemorrhages in details. Thirdly, we'll be discussing the ruptured berry aneurysm. A berry aneurysm is basically it's basically birth defect, and how are we going to detect it, the trauma related to it, and the alcohol associations are also discussed in this third section. Now, in the third section, we'll be discussing the rotational trauma. It is basically the basilovertebral artery injury that is more prone to whenever there is a rotational trauma. It is basically referring to whenever there are fall from the heights, there is a full or partial rotation on cervical or on the thoracic spine, and that is basically causing a lot of visceral damage. Now, the autopsy appearances and the mechanism of the vertebral artery trauma is discussed in this third section. The head injuries that are basically the boxers and the sportsmen are really prone to these head injuries, and the contact sports athletes, they're also very prone to head injuries. They're discussed in detail in this third section. It's basically the sports forensics. Now, the fourth section is basically the cerebral injury. Now, cerebral injury, as I was already discussing, it's basically the skull, and it can be the brain or the facial structures are damaged in this case. It's basically the mechanical events in the primary brain injury. They are discussed in detail in this fourth section. Moving over, we'll be discussing the mechanism of the brain damage and what are the consequences. The brain contusions and the lacerations are also discussed in this fourth section. Now, finally, in the fifth section, this lecture basically relates to the traumatic intracerebral hemorrhages. That is basically the primary brainstem hemorrhages and the coup and the contocoup damages. So it's basically a phenomena that we'll be discussing in this fifth section. What is the difference between the coup injuries and the contocoup injuries? How are they formed? And what are the consequences? Now, the concussions and the cerebral edema and secondary brainstem lesions. Concussions are basically the milder forms of the brain injuries, and they are discussed in the final section of this lecture. I hope you want to learn more about these intracranial injuries and how can we relate to them. Do watch the other sections for this lecture as well. Thank you for watching sqadia.com.